Time now to Ask the Expert. Here to answer your questions live on the air is Vice President of One Medical, Dr. Natasha Bhuyan. All right, let's get to it. Judy in Prescott, she says this: we have been trying to take supplements to ward off things such as colds. Do supplements really work, and if so, which ones?
Okay, this is a great way to save money. Most supplements don't work for warding off a cold, but there are a couple that can reduce the duration of a cold if they're taken at the first sign of a cold. That is zinc and vitamin C, but you don't have to take them every single day, so you can save your money.
Oh, okay, good to know. I'll remember that. All right, so we've got, is it Bofa? I'm not sure. From Queen Creek, is wheat bread or multigrain bread better for your health? That's a great question, and I've wondered this.
I hear this a lot. It's actually wheat bread that's better. The reason why: multigrain bread can contain multiple types of grain, but they're not always whole, whereas the wheat bread has more of the whole grains. That means it has more fiber and more nutrition, so more iron, more zinc, more copper, and more magnesium.
Okay, I'm switching. I used to always think multi was better. Exactly. Okay. Frank from Phoenix says, I don't have health insurance. What is the most cost-effective way to see a doctor? Emergency room, urgent care, and is it cheaper to see a nurse practitioner than an MD? Wow.
Yeah, so these days, if you don't have health insurance, the best way and the cheapest way to see a doctor is often through telemedicine. So doing things like a virtual visit. Lots of different platforms for this. So things like Amazon Clinic, you can do a virtual visit for $75. Even at One Medical, for our patients who are members, our virtual visits, our virtual chats are free.
Wow.
And it's free for our members, and so that is often the best way. But if you need to be seen in person and it's a routine thing, don't go to the emergency room. That's a really expensive way to get medical care. Okay. If it's routine, you can see a primary care doctor. A lot of them have sliding scales, so you can negotiate the cost, you can set up a payment plan. And then regarding a nurse practitioner or a doctor, interestingly enough, the price is the same. So you're actually just paying for the visit itself. And so regardless if it's with an NP or an MD.
Oh, okay, well, that's so interesting. Yeah. Right. Okay, way to tackle all of that.
Yes.
Anna from Tempe says, I hate to waste money going in to see a doctor for a cold. How can we tell when we should make a doctor's appointment or just talk to a pharmacist when we don't feel well?
Yeah, this is a really good question. Here's what I tell people. Message your primary care doctor. If you have a primary care doctor, oftentimes you can message them for free at no cost with no copay. Tell them your symptoms, tell them what's going on, and they can let you know if you need a visit or if you have a cold and if supported care works instead.
Oh, that's good. Okay, Allie from Phoenix says, how do I know if it makes sense for telehealth or in person for an appointment? Can I save money by scheduling a telehealth meeting rather than in person? You touched on this.
It also depends on your insurance. So some insurance, the copay is the same for a telehealth visit or in person. For others, it's different. Other people are doing cash pay and there might be different prices. But really, this is where you can use messaging. Message your own provider. Ask them if you need a visit in person. Ask them the price. I think doing that research ahead of time is really critical.
Okay, all excellent questions. Dr. Natasha, thank you so very much for all your